Susie Packman, Doctor of Physical Therapy and Certified Health and Wellness Coach. Today we're just going to go over some easy tips and simple positioning things you can do while you're lying down in bed and sleeping to help minimize any sort of neck or back pain you might be having. So first we'll start with side sleepers. So for a side sleeper, you want your shoulder to be underneath your pillow, and ideally you would like your head and neck just to be straight in line. So a large pillow would have you kind of propped up like this, and a too small pillow would have you kind of smushed down, and those can both put a lot of extra tension on your neck. Also, you can grab a second pillow and pop it in between your legs. And what this does is helps prevent your whole spine from rotating forward and can help just alleviate some of the pressure put in on your back. Also, if you do have neck pain, you can just grab a hand towel and you can roll it up and slide it right into the base of the pillowcase. And when you lie down here, you can adjust the size of your roll based on what's comfortable for you, but this can give just a nice support to your neck that can feel good if you are having some pain. So if you are a back sleeper, you want your pillow not to be really popping your head up so much. This pillow is probably a little bit too large for me if I were a back sleeper. And then when you're flat on your back, it can kind of put a little pressure on your low back. And so if you put a roll or pillow on your knees, that can really alleviate some of the pressure placed on that. And if you're a stomach sleeper, then ideally if you're using a pillow, you'd like it to be a really thin one, something small. And to take away some of the pressure in your low back, you can go ahead and put a pillow underneath your hips and pelvis area to just help decrease the pressure and decrease the pain. Also, your mattress is kind of important. So if you're a stomach sleeper, especially, you don't want it so saggy that it's not giving any support to your midsection. And one last thing is when you're getting up and down, if you are having any kind of pain, rather than kind of just flopping down and using your abs and same kind of straining back up, if you try to keep your whole body in line and then come down sort of as a unit, and then same when you're sitting back up, you're gonna push with your hand as you drop your legs off, so you're kind of staying pretty much in line, and that will alleviate a lot of the pressure put on your neck and back during that transition as well. Thank you so much for joining. I hope this helps. I'll see you next time.